I missed the question.
I will, I find this here. That's a funny.
Who's better?
I'm certainly aware of the fact that I was elected, among other things, because one of my main issues that I ran on was reforming healthcare. So what form that reform takes, is of course open to debate, but it was clear in 2006 that this was one of the top handful of issues that people in this district cared about and around the country as well.
Good evening, and thank you for seeing us. I'm a former hospital employee. I worked in a hospital for 11 years, so I do know the overburdening of the emergency room. I also know it is a law that when someone comes to the emergency room and has a life-threatening condition, they must be treated and they must be stabilized. So that law is already in place. What I would like to know is there any chance that we can make all insurance companies non-profit? I personally find it reprehensible and immoral that people are making money off our
Doctors and nurses. They make money from sick people too.
Okay, I'm taking this from this handbill. Relieving the burden of uncompensated care for hospitals and healthcare providers. In 2008, healthcare providers in the district provided $47 million worth of uncompensated care. Care that was provided to individuals who lacked insurance coverage and were not able to pay their bills. I'm not going to go on with what else is written, but this is in your handbill. And as you remember in our discussion, I asked specifically, if this bill passes, or whatever bill you pass, if it passes, will illegal aliens still be taxing our health care system? Because there's 14 million undocumented aliens in this country right now that are recognized. Either they be Latin, Eastern European, or from wherever. Now they go to the hospitals and they use up our health care, and then we, as taxpayers, have to foot the bill. 10 years ago, or a little over 10 years ago, 24 million were legalized in a period of time. These same people now are using our health care, haven't paid anything into it. What is going to safeguard the future with your health care plan if an illegal alien shows up at the hospital? They're still going to be using our thing. Am I correct or incorrect?
Well, the bill specifically in two sections prohibits the use of funds from this Bill H.R. 3200 for being used to provide health care for any person not legally in the United States. But I'm not going to stand here and tell you that this bill will cure the problem of illegal immigration.
My name is Chip Murray, Warwick, New York. Thank you for coming out tonight, and John, thank you. I don't think there's a single person in this room that feels good about the number of uninsureds in this country. I run a financial planning practice in Warwick, which many would say is a complicated business. And I would dare say, Congressman, that if I were to come into your house and try to sell you and your family on a program and leave you with a 1,000-page prospectus or description of my program and urge you to sign before I left or within a short period of time, you would probably toss me out of my ear. And my question to you is, why do we, the American people, deserve less than that?
I agree with you. You do not deserve less than that. It's not rushed as far as I'm concerned, and there's time. There is still time, sir, for you and anybody else in this room to ask more questions, to get the answers, to read the bill. And it has been up there for over a month at this point on the internet on several websites.
Against the wall, you had your hand up. You're next.
All right, Congressman, first of all, to follow up with the financial planner. The reason I think you brought that out is the president tried to shove us down our throat.
Yeah. Can't deny it.
The other thing, we're being told that this can be financed through cutting out waste, fraud, and abuse. I don't understand why you don't do that first.
Sir, do you have a question?
Yeah, that was the question. Why don't you do that?
Okay.
And then the other point to follow up on that is I don't trust this anymore because we're always being told what's gonna be done, not what you can do. If you can show us the savings in waste, fraud, and abuse, then I think the country would get behind you. Otherwise, it's just words.
Right. Well, thank you.
That's right, everything's good. Why don't anyone ask about malpractice insurance and the lawyers who are filling their pockets with the lawsuits? Control that first.
With all due respect.
Please.
With all due respect, I asked the question as why can't you show us that you can stop waste, fraud, and abuse without telling us this is how you're going to fund the bill? Because if you don't do it and you know how to do it, we're being told you can do that, then that is malpractice, that's malfeasance, that's dereliction of duty.
Okay. All right, sir.
I asked the question.
Well, you know, one of the ways that we can do it fastest is by including it in this bill. I mean, I'm telling you that this bill will come to a vote in the House in September. We can vote as a part of this package to eliminate waste, fraud, and abuse in Medicare and Medicaid, or we can have the bill defeated or dropped or go by the wayside and introduce a separate. But, and then have a separate bill introduced to have to create a special inspector general. Or as a member of Congress, I do not have subpoena power, and I can't personally go and do what you're asking me to do. So, but I appreciate your point. It's a point well taken.
President could,
Okay.
not Mr. Hall.
The gentleman over there.
My second question is, I've read most of H.R. 3200. Can you tell me what parts were written by Republicans? Our president has said that he wants a bipartisan effort, and I've tried very hard to find where Republicans have had a say in H.R. 3200, and I'm sorry I'm coming up short, so I need your expertise to show me where that is.
Okay. In which members of the minority party at the moment, the Republicans who were in the majority until 2006, say we want to work with you, just not on this.
That's not true.
It is true. It is true. I will tell you because I'm there.